Good morning and welcome to your Farm and Home Show. I'm Kristi Shive, and this morning we're visiting with Sarah Widener. She's Director for Med Center Health and Wellness. Good morning, Sarah.
Good morning, Kristi. Thanks for having me today.
Thanks for being with us, Sarah. Now, May is Stroke Awareness Month, and that is what you are here to talk about today. Sarah, can you talk to us about the risk factors for a stroke and what a stroke is?
Sure. So stroke is basically it happens in the brain. So sometimes we get confused between stroke and heart attack. But stroke is something that happens in the brain. There's a couple of different types of strokes that can happen, but that blood flow is cut off to the brain. So what we have learned is about 80% or up to 80% of strokes are preventable. So knowing what your risk factors are very important. There are controllable risk factors and there's uncontrollable risk factors. So as we age, our risk for stroke goes up. We don't have control over that. Having a family history of stroke puts us at higher risk of a stroke. We also don't have control over that. But some things that we do have control over and we need to know about are blood pressure. So if you have high blood pressure, keeping it under control. If you have diabetes, making sure that your blood sugars are kept under control. Things like smoking. If you smoke, that puts you at a higher risk. So trying to quit or significantly cut back on that. Physical inactivity. So if you don't live a physically active lifestyle, you want to start. And then being overweight, or obese can also put you at a higher risk. So those are risk factors that when you know you have them and say it's combined with a family history, you know that maybe we need to be doing something about those things.
Yes, and some of those are things that we can make lifestyle changes and be proactive about. So, Sarah, are there populations that are at higher risk for stroke?
Yes, great question. There are. So African Americans are actually at higher risk for stroke. Part of that is because they are at higher risk or have more hypertension or high blood pressure. So again, one of those risk factors that's not controllable, but when you know, you can do better. So again, if you're at higher risk and you have high blood pressure, then keeping that under control.
Now, Sarah, we know that this is not an enjoyable topic, but it's so important to know signs and symptoms of a stroke. Can you go over those with us?
Yes, absolutely. We like to use the acronym Be Fast. So that will just help you quickly remember the signs and symptoms. So be balance. So if somebody's balance or your balance is suddenly off, and these are things that you want to look for either in yourself, if you think something's not right, or if something's not right with one of your, somebody you are around. So balance, eyes, if you have a sudden change in vision, fast, so face, if one side of the face is droopy. A would be for arms. If you have numbness or weakness in one arm, you can't lift that arm. Speech, so if speech is slurred or you can't get your words out or you're asking somebody a question and they can't answer you appropriately. And then time. So time is brain cells. And that's what happens when we have a stroke is it's affecting our brain. Most of those brain cells we're not going to be able to get back. So we want you to remember time and we want you to call 911.
Okay, so if anyone is having any of these symptoms, very important to call 911, even if it may end up being nothing. It's always better to be safe than sorry. You all have a lot of great resources at Med Center Health. If someone wants more information, how can they contact you all?
Yeah, so they can go to our website very easily, medcenterhealth.org, and type in stroke, and you're going to pull up lots of information there. The other thing, you can do is talk to your doctor. So talk to your medical provider about what your risks are for stroke, what you need to know, and maybe if there's anything that you need to change, like we talked about those lifestyle factors that you can change so that you can reduce your overall risk of stroke.
All right, Sarah, thank you so much for being with us today as we talk about Stroke Awareness Month. So many great tips for us today. Thank you for joining us today on the Farm and Home Show, and we'll see you next time.